back to another video of sulfonamides. In my previous video, you can observe the introduction, classification and mechanism of action and some uses. Here we are going to discuss briefly about the classification and adverse drug reactions and adverse effects. First, short acting. Example, sulfadiazine. Sulfadiazine pharmacokinetic properties are it is a prototype and rapidly absorbed through the oral route and rapidly eliminated through the urine. Plasma protein binding is about 50% and it is 20 to 40% acylated. Good penetrability in the brain and CSF was the most preferred compound for the meningitis. Dose 0.5 mg to 2 grams. Here you can observe a tablet strip. It is very important for a pharmacy student in our daily life. You have to go through the any tablet strips or syrups, different types of syrups you can observe in your home or else where you go to your relative's house or else where you observe those tablets and a pharmacy related compound. You should go through those composition. It is very essential in your daily life. Example, sulfametazole. It is slower oral absorption and urinary excretion, resulting in intermediate duration of action. Example, its half-life is about 10 hours. High fraction is acetylated, which is relatively insoluble, which can occur crystalluria. Here comes the long-acting drugs. Sulfadoxine, sulfamethoxypyrazine. Sulfadoxine and sulfamethoxypyrazine are the ultra long-acting compounds. Action lasts for 1 week because of the high plasma protein binding and low renal excretion. Its half-life is 5 to 9 days. They attain low plasma concentration and not suitable for the treatment of acute pyogenic infections, but are used in the combinations with the pyranethamine in the treatment of malaria. As we all observed some 3 questions in my previous lecture, here is the second question answer. What are the drugs used for the treatment of malaria? Sulfadoxine or sulfamethoxypyrazine in the combination with the pyranethamine is used for the treatment of malaria. Next one is special purpose sulfonamide. Sulfacetamide sodium, which is highly soluble compound yielding a neutral solution which is only mildly irritating to the eye up to a concentration of 30%. Used topically for the ocular infections due to the susceptible bacteria and chlamydia, including the Ophthalmia nictorium caused by the chlamydia oculogenesis. Mephenide is the another drug. Mephenide, used topically, inhibits a variety of gram-positive as well as gram-negative bacteria. Active agonist Pseudomonas clostridia, active in the presence of pus. Mainly employed for the burn dressing to prevent the infection, but not to treat already which is infected. There are some limitations for every drug. Here we go some limitations about it. Produces burning sensation and severe pain when applied to the raw skin, which is rapidly absorbed through the raw skin and metabolized and excreted in the urine. Particularly, it causes rashes. Mephenide and its metabolites are the carbonic anhydrase inhibitors, sulfadiazine. In the drug itself, we know the action, where the silver ions are released slowly and which produces an antimicrobial action, which is used topically. Has 1% cream. It is having an active against large number of bacteria and fungi, even those resistant to another sulfonamides like Pseudomonas. Most effective drug for the preventing the infection of the burn surfaces and chronic ulcers, and it is well tolerated, but it is not used for the established infection. Side effect: burning sensation on application and it causes itch. Interactions: sulfonamides inhibit the metabolism of phenytoin and tolbutamine. Displaces the methotrexate from binding and decreases its renal excretion, and which causes the toxicity. Adverse effects: crystalluria, photosensitization, epigastric pain, Steven-Johnson syndrome. It is a syndrome which causes a reddish pinkish rash on the skin, as you can observe on the images in the clip. But it is very serious disorder, and it is a rare disorder which is caused by the long acting agents. Triticuritis, separated in newborn. Triticus is a disorder where it is a disorder which increases the level of the bilirubin in the baby's blood, and hemolysis can occur G6PD deficient in individuals with high doses of the sulfonamide.